You are watching Feldenkrais Awareness Through Movement lesson. The title of the lesson is Roll Pelvis Side to Side. Let's begin. Lie down in supine on the floor, please. Elongate legs and arms. Pay attention to the direction of the left toes. Are they open as the right toes? Or toes of left and right foot are directed different direction? Pay attention to knees. Do you feel any tension in the muscles around knees? Is the tension different between the left and the right? Stand legs please, which means to bend knees and soles of feet are on the floor. Once again, pay attention to the direction of each foot. You may not feel as clearly as when legs are extended, but this is a good awareness of the fact. Pay attention to knees to feel the tension of legs. And rest with legs long. Stand legs again. Roll the pelvis left and return to the center. You go only to the left, and then come back to the center. How do you do this? You may push the right leg to roll the pelvis to the left. Or you can use the left side of the muscles around the hip joint to pull the pelvis to the left. In this case, you may feel less effort the leg muscle and feel the leg as light. If you pay attention to the knee, it effortless moves to the ceiling. Do it gently and slowly to feel the whole body. Pay attention to the pressure of the left foot. Does it change as the pelvis rolls? Pay attention to the pressure of the right foot. Does it change as the pelvis rolls? Which part of the right foot takes the most pressure? Can you change it? Push the toes of the right foot to roll the pelvis to the left. Push the heel of the right foot to roll the pelvis to the left. Now extend the left leg. The knee is straight on the floor. Once again, roll the pelvis to the left by any mean you like. And feel how the toes of the left foot turn. This turning is mostly the function of the left hip joint, Do you feel it? Stand the left knee again to feel the difference. The floor stops the turning of the left toes, but there is such a pressure to the left hip joint. Do you feel it as clearly as when the left leg is long? Rest please with legs and arms long. Remember the awareness you have obtained at the left hip joint while changing the state of the left knee. Stand knees please. Push the right foot onto the floor to roll the pelvis to the left once again and feel the tendency of the left knee tilting to the left. Next time the pelvis rolls to the far left, stay there. Okay? If the left knee is tilted now, take it to the right slightly to counter the pressure at the hip joint. So the left knee tilts to the right and left. There is no need to use the power. Do it gently and slightly to gain an awareness. Now you are differentiating the left hip joint in the first way. The left leg from the pelvis. Leave it and rest with legs long. Stand the legs again. Tilt the left knee to the right a few times. Next time the left knee is far end of the right, stay there. Now tilt the pelvis to the left and return to the center, or null position a few times. So now, the left knee is tilted to the right and stay still. The pelvis rolls to the left and return to the center. This may be a bit awkward movement since the knee tilted too far and the pelvis is less mobile than legs. Do it gently and gently so that you search for. How can you easily move the pelvis to the left in this awkward position of the left leg? This is the second way of differentiation. Leave it and rest with legs long. Stand legs again. Now, push the right foot onto the floor to roll the pelvis to the left and at the same time tilt the left knee to the right. So the left knee and the pelvis come closer to each other and then go away. The right knee stays standing at the same place in the air. To put it in another way, the right knee does not go left and right, though it may move closer to the ceiling and away from it a little bit. Repeat this again and again, slowly and gently, looking for awareness, not the stretching feeling or anything else. This is the third way of the hip differentiation. Remember, you fixed the pelvis in the tilted position and moved the left leg in the beginning. Then you moved the pelvis while the left leg is tilted position. Now you moved both the leg and the pelvis. Those are the basic 3 ways of the differentiation. And rest with legs long. Stand the legs again. Roll the pelvis to the left and return to the center. Feel how little the left toes turn to the left. Feel the pressure on the left hip joint. Is it far less than before? Now, extend the left knee and do the same movement slowly and gently. Feel the direction of the left toes. Feel the pressure on the left hip joint. Leave it and rest with legs and arms long. Now we do it with the other side, but only in your imagination. Stand legs please. Imagine to roll the pelvis to the right and return to the center. All the while, try to remember how you felt in the other side. Feel what is happening to the toes of the right foot. Feel what is happening to the right hip joint. Now, keep on tilting the right knee to the left and bring it closer to the pelvis while tilting the pelvis to the right, and then return to the starting position. But do all this in your imagination. So the pelvis and the right knee come closer and away. Imagine the movement very slowly many times. Once your imagination became rather vivid or clear, do it actually once or twice. Rest with legs long in your imagination. Rest with legs long actually. Stand legs again. Roll the pelvis left and right gently and slowly. Feel how knees stay at the same position in the air. Feel how low the pressure is on both hip joints. Leave it and rest with legs long. Once again roll the pelvis with legs long. The pelvis rolls less than before, but this position is closer to the standing straight. Stand up, please. Stand with feet comfortably apart. Try to roll the pelvis right and left slightly and feel the pressure at hip joints. Feeling like this, start walking. This concludes the lesson. Thank you.